Good morning. Thank you for the NGR for funding this work and allowing us to talk about this project looking at total elbow replacement in England. In this analysis, I'll be describing the incidence of total elbow replacement in England, and I'll describe the characteristics of patients, implants, and provide the characteristics of the surgeon and the hospital. To do this, we use the National Joint Registry data. This is the largest elbow data set worldwide. And to gain information regarding ethnicity, complications, and length of stay, we link this data to the HES APC data. We also use population estimates from the Office of National Statistics to calculate the incidence, and we use mortality data from the registration of death. We use all primary total elbow replacement data since the start of data collection in April 2012, but we excluded patients that did not consent for the procedures to use the NJR. We also excluded patients of which the components that were submitted to the NJR did not match the procedure, and thanks to Adrian for doing this very large piece of work, and also for any megaprosthesis in the NJR. The primary outcome was annual volume and rates of total elbow replacement, but we also looked at elective waiting times, serious adverse events, and the number of total elbow replacement per surgeon in hospital. We included 3,891 total elbow replacement, and the majority of these were elective procedures. And we were able to link over 80% of this to HES data, and the main reason for non-linkage is the timeline we had for the HES data was shorter than the NJR data. So coming to the results, the incidence of total elbow replacement ranged about 0.7 to 0.8 per 100,000 persons prior to COVID-19. But this is half at COVID-19 and recovered slightly afterwards. And if you look at the green line on the graph here, the main reason for that is a decline in the number of elective procedures. But if you look carefully at the red line, there has been a decline in the incidence of total elbow replacement for acute trauma. And the main reason for this is there has been an increase in the use of distal humeral hemiarthroplasty for trauma, which is used instead of total elbow replacement in some centres. In England, inflammatory arthritis remains the main indication for total elbow replacement. In some other part of the world, such as America and Australia, this has changed and acute trauma became the most predominant indication for surgery. Looking at the population, at the patients themselves, you can see that female patients at all age groups have higher incidence of total elbow replacement, and it's mainly performed in patients over the age of 60. We looked at the incidence by socioeconomic group, and in the crude analysis, we found that patients living in the least deprived areas to have higher incidence of total elbow replacement. When we adjusted for age and sex, we found the opposite, that people living in the most deprived areas to have higher incidence of total elbow replacement. And throughout the years of the analysis, total elbow replacement was higher in white ethnic groups. Regarding the implants used, the Conrad-Murray implant and the Discovery has been declining over the years, even prior to COVID-19. And there has been an increase in the use of the Latitude EV implant. And in fact, in the most recent year of the analysis, in 2022, the Latitude EV implant is the most used implant in England. And patients had to wait approximately 100 days for their elective total elbow replacement prior to COVID-19, and that doubled after COVID-19, and it improved ever so slightly in the last year of the analysis in 2022. We looked at serious adverse events, and as you would expect in the acute trauma group, there's higher rates of serious adverse events and mortality. But again, in the acute trauma group, people living in the most deprived areas had higher rates of mortality and serious adverse events compared to people living in the least deprived areas. And I'm going to present the total elbow replacement numbers by hospital, and if the median is 2 to 3 in hospitals per year in each region. And if you look at the cumulative number in the whole region, the annual median ranged between 57 and 19 procedures. Then we looked at the hospitals providing the highest numbers of total elbow replacement in each region, and they were providing a median annual of 6 to 16 procedures. And if we look at the reconfiguration of total elbow replacements, and with the hub centers, you're going to have 1 to 2 hubs per region, then you'd expect 2 to 6-fold increase in the number of total elbow replacement per hub and that will need resources to address that. So in conclusion, total elbow replacement is more common in older patients, female and white ethnic groups. COVID-19 has impacted the total elbow replacement numbers, and the waiting times and the recovery is still ongoing. Patients living in the most deprived areas have higher rates of failure in acute trauma group, and service reconfiguration will result in 2 to 6-fold increase in the number of total elbow replacement in the central.